The expertise-oriented approach to evaluation is the oldest type of formal public evaluation and was used before formal approaches were developed. Though it's difficult to trace the origins, this approach was formally used in the 1800s when the standardization of college entrance requirements began. The expertise-oriented method of evaluation is different from others because it relies primarily on professional expertise to make a judgment on the quality of a program or product. For example, a hospital program would be evaluated by experts in the particular field of medicine. With the exception of ad hoc individual reviews, a team of experts is always selected to carry out evaluations. Having the knowledge and opinions from multiple experts provides sufficient information for the group to render a judgment about the value of the program being evaluated. One of the foremost theorists of expertise-oriented evaluation was Abraham Flexner, an educator best known for his role in the reformation of medical institutions throughout the USA and Canada in the early 1900s. He was also responsible for qualifying the process of accreditation. Flexner evaluated many medical schools, and the result was the Flexner Report of 1929, which revolutionized medical education. In consequence, inferior medical schools were forced to close their doors. Flexner's approach is much like that of contemporary evaluation, where the evaluators see professional judgment as an essential requirement. Elliot Eisner was another theorist that provided the foundation to the expertise-oriented approach by discussing what evaluation should be. He drew from the arts, which in the 1970s was a useful counterpoint to the emphasis on social science methods and program objectives. The key concepts of Eisner's approach are connoisseurship and criticism. Connoisseurship is the art of appreciation and the ability to recognize and notice subtle but significant differences, whereas in an educational setting, criticism is the public side of connoisseurship. In present times, the expertise-oriented approach is used primarily in the accreditation of institutions of higher education. Accreditation is a formal review system wherein approval is granted to institutions, most notably in law, medicine, and education. Accreditation is comprised of a structure or organization that is established to conduct periodic reviews. It has published standards, a pre-specified review schedule, a number of experts to judge overall value, and an impact depending on the outcome of the evaluation. As a process, accreditation has two fundamental purposes. First, to attest to the quality of an institution or program by periodically assessing their processes, procedures, and outcomes. And secondly, to assist in improving that quality by asking questions like what changes occurred, or are we satisfied with the results? Countries like Germany, the Netherlands, India, and the United Kingdom are required by law to have their higher educational institutions accredited. In Canada, however, there is no accreditation process for higher education because most institutions are overseen by the provincial government. In the first stage of accreditation, the institution is required to prepare a self-study report describing its mission and its progress toward that mission. Additionally, the institution needs to provide information on how it meets the standards of the accrediting body. The second major stage is the core of the expertise-oriented approach. A team of peers, faculty, and administrators from other institutions in the region receives the report and proceeds to conduct a site visit, where they interview faculty and students, they review institutional records, and observe facilities and classrooms. Based on information gathered during the review, the team writes a report expressing their views regarding the institution, their recommendations concerning its accreditation status, and their recommendations for improvement. Nevertheless, some controversy does exist around accreditation. Though accreditation is used as a tool for improvement, one issue of contention is the purpose of accreditation itself. For example, critics believe accreditation should provide students with information that helps them make decisions on which institution to attend. Another area of disagreement is about what factors should be considered in accreditation. In the past, decisions in higher education have relied heavily on reputation and financial resources, like IT capacity or classroom space, rather than focusing on student outcomes. Perhaps the most prominent limitation voiced by critics is the central role of the expert judge. Critics suggest the use of expert judges permits evaluators to make judgments that are personally biased, inherently conservative, potentially incestuous, and are not based upon program objectives. While accreditation is a formal review, there are also effective informal reviews, which have their own set of procedural guidelines and use multiple reviewers. For example, the systems established for peer review of manuscripts is considered an example of an informal review system. Other forms of expertise-oriented evaluation are ad hoc panel reviews or ad hoc individual panel reviews. Panels are commonly used to develop standards, make recommendations, or address a particular issue. For example, blue ribbon panels are typically used within government to provide advice on how government should address a particular issue. Overall, expertise-oriented approaches to evaluation emphasize the central role of expert judgment, experience, and human wisdom in the evaluation process. Flexner argued that common sense was perhaps the most relevant form of expertise.